Hello everybody, this is Sam over at the Foot Whisperer Reflexology Institute with another technique video for you. This technique video is kind of long, so I wanted to make the intro short, but in this video we are going to be walking the spinal and head and neck reflexes, also known as walking the medial arch and the toes. Technically difficult when we get to the toes, but really powerful, and about 95% of my business comes from back and neck issues. So definitely a valuable skill for the budding reflexologist to learn. And without further ado, enjoy. Okay, everybody. So first and foremost, what we're going to do, just like we did in the previous video for technique, we have to draw our guidelines so we know where we're walking. So just like in the other video, we're going to start with the shoulder line guideline. The shoulder line guideline is right where the toes meet the ball of the foot. Boop. And that line helps us delineate where we're going to be walking, especially with the toes and the head and neck reflexes, from the ball of the foot, which represents chest and lung. Then we have to draw the diaphragm guideline, which is at the base of the ball of the foot and separates the ball of the foot from the arch. Then we have our proximal head of the fifth metatarsal, which if you just run your finger down the outside of the foot, you'll feel that bump on the outside of each foot. That represents our waistline guideline and helps us divide the arch into the upper lower core reflexes. Then we draw our pelvic guideline right at the top of the heel as the heel starts to pick up to form the arch. And those are our four major guidelines. Now we are going to be using these guidelines in the video more so than the last video. We found our solar plexus and adrenal reflex points in the last video, and here we're really going to focus on the spinal and head and neck reflexes, which these guidelines help us to find very, very easily. So in the video, you're going to realize that we are only going to walk the middle section of the arch. And the reason for that is because in future videos, I'll be teaching you how to walk the lower section of the pelvic reflexes, specifically that sacral coccyx reflex. And we're going to be focusing majorly on the lower back reflexes and the middle back reflexes, or the lumbar spine reflexes and part of the thoracic spine reflexes. The problem with going up into the bunion area is that this area gets really, really sensitive. So we're only going to walk the plantar surface of that when we learn how to walk the ball of the foot in future videos. And we're going to avoid walking along the side of that area because overall my experience has shown that it is extremely tender and we don't want to touch that area. So we're largely going to be walking from the pelvic guideline all the way up the medial arch and stopping right there at the diaphragm guideline. And you can do this on both feet. I'm just going to show you on one because we're going to just show this technique on one foot, but this can be done on both feet. And then from that spinal reflex, we're going to walk that 3 times. Then we're going to go to the toes. And with the toes, we're going to use a 2-finger grip on back and a thumb grip on the base. So we're going to kind of be sandwiching each toe. And then we're going to use a nice squeeze, pull, and slightly twist. Slightly twist, no popping, no toes. And no trying to twist the toe off, but we're going to do that 3 times each toe. And these are all of those head and neck reflexes, so very important. During a normal reflexology routine, I actually walk the toes twice because they are that important. Then we're also going to do that with the big toe, but I'm not going to draw that because we have a separate big toe routine that we need to cover as well. And the way that we walk the big toe, because it's big and it needs the attention, is we're going to start with the medial surface of the toe, and we're going to walk up the medial surface of what's known as the proximal hallux phalanx, or not the pad, just the neck of the big toe 3 times. Then we're going to go to the plantar surface of the proximal phalanx, or the underside of that neck of the big toe, and in 5 sections we're going to walk up just 1 time each, but a total of 5 passes to make sure we really get into all of those sensitive neck reflexes on the big toe. Then we go to the pad. We're going to walk up the pad in those same 5 sections, once each, but the pad is thick and we really want to make sure that we get all of it. So 3 times medial surface, 1, 2, 3, 4, 5 proximal phalanx, 1, 2, 3, 4, 5 distal phalanx or pad. And then you'll see in the video that we're actually going to use our fingers to reach over and curl into this lateral surface of the big toe, but we're actually going to be walking down that surface, not up that surface, and we're going to do that 3 times as well. So just to recap on we'll use the other toe as an example. Up the medial surface 3 times, then 1, 2, 3, 4, 5, and then 1, 2, 3, 4, 5, and then 5, and then down 3 times. Sound pretty good? So spinal reflex 3 times only in between the pelvic and diaphragm guidelines, really focusing on the meat of that arch. Then each toe 3 times, including the big toe, but then the big toe also has its separate routine. So I hope that that explains how we're going to walk the spinal and head and neck reflexes, and here is the video to show you how. Starting from the pelvic guideline to the diaphragm guideline, apply a light gloss of cream, just enough to make it so the thumb doesn't have to work so hard. Medial hand scoops the heel, and then thumb places on those lower back reflexes, using our thumb walk, our alternating pressure, until the thumb can't reach anymore. Then switch your leverage, with the fingers coming on top of the foot, and finish the walk all the way to the diaphragm guideline, staying on the meat of that arch and repeating the walk 3 times. Really making sure that you have 3 solid passes here, palpating, knowing where you're deviating from the lower back reflexes to the thoracic reflexes, really important from an assessment standpoint, and really just using this technique to help decompress all of those nerves and muscles in the arch. Then we move to the toes. Starting with the 5th digit, we're going to use a 3-finger grip, 2 in back, thumb in front, and we are going to gently squeeze, rotate, and pull. This is not a yank, ladies and gentlemen. We are not trying to pop the toes. Hate that technique. Instead, we are gently bringing circulation to each toe. Going through each toe 3 times systematically like this really gives us a good rush of circulation into the very sensitive nerves in the toes. The toes have a function of sensing our environment, and they have a lot of nerve endings. If you've ever stubbed your toe, you know this. So really taking your time here, walking up each toe systematically. We actually will walk the toes twice during a full 60-minute routine because they're that important. Finishing with the big toe 3 times, and then we actually have a full separate technique for the big toe as well, which will come in just a few seconds. Starting on the medial surface of the proximal phalanx, then going to the plantar surface, then the distal phalanx plantar surface, and then around the top, down that lateral edge. Start with your thumb walk, really nice, tiny bites. This is a small surface, but we're going to do it 3 times. This really represents the core spinal reflexes of the neck. Then moving to our 5 vertical walks, which is really tracing from the center line of the neck to the lateral structures. Moving right up into the pad. Big toe pad is all about the head, face, jaw, teeth, eyes. Really important to take your time here. There's a lot of thick paddy tissue, but a lot of very important reflexes as well. And last one. Then using your fingers, we're actually going to curl over the top and hit that lateral surface. But you can't really see it in this view, so I'm going to show you in a second view in just a second. And 3. Switching to the other view, you can see how I'm really on that inside lateral edge. And then using the fingers to curl in. It's a small surface, just like the medial surface. But hitting this area, you can really see how intricate it is, but very important from an overall reflex standpoint.